I work in the ER. We had a guy come in absolutely screaming his head off, convinced he had gangrene or some sort of rapid necrosis in his legs, because his skin had turned a dark, bruised blue colour. He was demanding immediate amputation to save his life. I put on my gloves, took an alcohol swab, and wiped his thigh. The blue came right off. He had bought a new pair of unwashed, dark denim jeans and walked in the rain. The dye bled onto his legs. He left in shame immediately. A young guy came into the urgent care, terrified, because he thought he had testicular cancer. He said he found a third lump down there, and it was painful. He was sweating bullets and looked like he was about to cry. The doctor went in to examine him and came out 2 minutes later, trying so hard not to laugh. The guy didn't have a tumour. He had an unruptured pimple on his scrotum. The doctor popped it, put a band-aid on it, and sent him home. The relief on his face was palpable. I had a patient who was convinced her brain was leaking out of her nose. She had been looking up symptoms on WebMD and decided that her runny nose was actually cerebrospinal fluid leaking from a skull fracture. She demanded a CT scan and a neurosurgeon. I had to explain to her for 20 minutes that it is springtime, the pollen count is at a record high, and she has allergies. She eventually accepted a prescription for Claritin, but told me to mark her words when her brain deflates. I am a pharmacist. A lady called the pharmacy in a panic, saying the suppositories I gave her for her hemorrhoids tasted awful and were making her gag, and she wanted to know if she could crush them into applesauce instead. There was a long silence on the phone. I had to explain to a grown woman that suppositories are not for oral consumption. She hung up on me instantly. I really hope she didn't chew them. My sister is a nurse, and she told me about a guy who came in, convinced he was going blind in his right eye. He said everything was blurry and he was losing depth perception. He was talking about learning Braille and getting a guide dog. The triage nurse looked at him and asked, "Sir, do you wear contact lenses?" He said yes. Turns out he had rubbed his eye and the contact lens had folded over and shifted to the corner of his eye. She fished it out and his blindness was cured. I had a college student come into the clinic crying because she thought she was internally bleeding. She brought in a sample of her stool and it was bright red. She was reciting her last will and testament, basically. I looked at her chart and saw no history of GI issues. I asked her, "What have you eaten in the last 24 hours?" She paused and said, "Well, I got the munchies and ate a family-sized bag of flamin' hot Cheetos." I diagnosed her with Cheeto butt. She was fine. A woman came to the ER insisting she was in labour. She was screaming, holding her stomach, breathing in patterns, the whole 9 yards. The issue? She wasn't pregnant. We did a test, an ultrasound, everything. No baby. She argued with the OBGYN, saying that she knows her body and that the baby is just hiding behind her spine. It turned out she was severely constipated and just had massive gas cramps. A suppository delivered her problem. I worked at a campus health centre. A freshman came in terrified because he thought he had a flesh-eating parasite in his arm. He showed me the inside of his wrist, where he could see blue lines running up his arm. I stared at him for a solid 10 seconds before realising he was serious. He was extremely pale because it was winter, making his veins very visible. I had to explain to an 18-year-old man that those are his veins, not worms. A patient booked an emergency appointment with her dermatologist, me, because she thought her skin was rotting off. She came in wearing long sleeves and sunglasses. She showed me her shoulders where the skin was peeling. She had gone to the beach 2 days prior without sunscreen. It was a sunburn, just a normal peeling sunburn. She genuinely thought she had contracted leprosy or a flesh-eating bacteria from the ocean water. We had a frantic mother bring in her teenage son saying he was having a heart attack. He was clutching his chest and groaning. We hooked him up to the EKG immediately, perfectly normal rhythm. We asked him where the pain was specifically. He pointed to his sternum. We asked if he had eaten anything spicy. He said he ate 20 buffalo wings on a dare. It was extreme heartburn. We gave him an antacid cocktail and he was fine in 10 minutes. A guy came into the clinic convinced he had contracted a rare tropical disease that turns your skin orange. He had never left Ohio. He was actually slightly orange tinted. During the history taking, he mentioned he was trying a new health kick diet. He was juicing 5 pounds of carrots and drinking it every single day. It was carotenemia. He literally turned himself orange from too much vitamin A. I told him to lay off the carrots. I had a patient who was convinced she had a tumour in her neck. She said she could feel a lump on both sides under her jaw and they were swollen. She was demanding a biopsy. I felt them. They were her lymph nodes. They were slightly swollen because she currently had a sore throat and a cold. I explained that this means her immune system is working properly. She was disappointed she didn't get to be on Grey's Anatomy. An older gentleman came in scared that he was having a stroke because he couldn't feel his legs when he woke up in the morning. He said they were dead weight and tingly. I asked him how he slept. He said his cat, who weighs about 20 pounds, likes to sleep across his legs. I told him to lock the cat out of the bedroom for a night. He called back 2 days later saying his paralysis was cured. I had a girl come in convinced she had breast cancer because her nipples were leaking discharge. She was about 22. She was panicked, shaking, the works. I asked if there was any chance she could be pregnant. She said, "No way, impossible." I did a test anyway. It was positive. She wasn't sick. She was just very pregnant and starting to produce colostrum. She fainted when I told her. A frantic parent brought their toddler in because his guts were falling out. They showed me the child's belly button. It was an outie belly button that had popped out a bit more because the kid had been crying, screaming. They thought the umbilical cord knot had come undone and his intestines were unraveling. I had to explain that belly buttons are scar tissue and do not act like a drawstring bag for your organs. I work in dental. A patient came in crying, thinking her jawbone was disintegrating and coming out through her gums. She showed me a hard white shard poking out of her gum line. It was a piece of popcorn kernel that had been stuck deep in there for days and finally worked its way out. I flicked it out with a scaler. She was so embarrassed she tried to pay me double. We had a lady who thought she had a parasitic worm infestation in her stomach because her stomach was growling loudly and moving. She said she could feel them slithering. I listened with a stethoscope. It was literally just digestion sounds. She was hungry. She kept insisting it was a tapeworm. I eventually convinced her to eat a sandwich and see if the worm stopped. It did. A teenager came in convinced he had shattered his spine. He was walking perfectly fine, but terrified. He said he felt a huge bump on the back of his neck that wasn't there before. It was his C7 vertebrae, the prominent bone at the base of the neck that everyone has. He had just lost some weight recently, so it was more visible. I let him feel the back of my neck to show him I had one too. I had a patient convinced he had throat cancer because he coughed up a piece of his lung. He brought it in a napkin. It was a small, white, foul-smelling chunk. It was a tonsil stone. I explained that it's just calcified food and bacteria caught in the tonsils. He almost vomited when I told him what it was, but he was happy he wasn't dying. A woman came in screaming that her hands were paralyzed. They were clamped shut in a claw-like position. She was hyperventilating like crazy. It was carpopidal spasm caused by hyperventilation. Basically, she panicked so hard about something else that she blew off too much CO2, causing her hands to cramp. I had her breathe into a paper bag for 3 minutes and her paralysis vanished. I work as a paramedic. We got a call for a severe hemorrhage. We arrive and the guy is standing over the sink, spitting red. He says he's coughing up blood and dying. We look in the sink. It smells like mint. We ask, "Did you just brush your teeth?" He nods. "Did you use a new toothbrush?" He nods. He had gum gingivitis and brushed too hard. He called 911 for bleeding gums. A frantic boyfriend brought his girlfriend in because she had a giant tumor appear on her head overnight. It was huge and tender. I parted her hair to look at it. It was a tick, a very large, engorged wood tick. She had been hiking the day before. I removed it with tweezers. The tumor was put in a specimen jar and they left. I had a guy convinced he had diabetes because his urine tasted sweet. Yes, you read that right. He tasted his own urine to self-diagnose. I ran the labs. He did not have diabetes. He did, however, have a very awkward conversation with me about why he shouldn't drink his own bodily fluids. He said he saw it in a survival movie. A woman came into the urgent care, convinced she had a blood clot in her leg. She pointed to a painful red line. It looked suspicious, so I started asking questions. She admitted she had fallen asleep on her phone charger cord. The blood clot was an indentation mark from the braided cable. It faded away by the time she was discharged. A young man came in, convinced he had rapid onset dementia. He said he was losing gaps of time and waking up in strange places, his living room floor. He had started taking Ambien for sleep a few days prior. He wasn't sleeping, he was sleepwalking and having amnesia, which is a known side effect. He wasn't losing his mind, he was just drug-induced tripping. I had a patient who thought she had a hole in her heart because she could hear her heartbeat in her ears when she lay down on her pillow. I checked her blood pressure. It was a little high, but fine. I explained that when you put your ear against a pillow, you compress the artery slightly and can hear the blood flow. She thought she was mechanical. A guy came in, convinced he had bone cancer in his shin. He said there was a dent in the bone. I felt it. It was perfectly normal. He kept comparing it to his other leg. It turns out his other leg was swollen from a bug bite, making the normal leg look dented by comparison. He was diagnosing the healthy leg as the sick one. I had a patient convinced he had a tapeworm because he was losing weight rapidly despite eating normally. He was very excited about the tapeworm idea for some reason. I asked him about his lifestyle changes. He had started a very physically demanding construction job 2 weeks prior. He was burning 4,000 calories a day. He didn't have a worm, he just had a job. A woman came in crying, saying her skin was turning into plastic. She showed me a patch on her arm that was shiny and tight. She had spilled hot wax on herself while waxing her eyebrows and didn't realize it dripped. I peeled the wax off. She was stunned. She thought her skin was hardening into a shell. I had a guy come in, convinced he was having an allergic reaction that was closing his throat. He was breathing fine, but said it felt tight. He was wearing a brand new dress shirt. The collar was a size 15. His neck is a size 16. I told him to unbutton the top button. He was instantly cured. A mother brought her daughter in because her bones were clicking. Every time the girl walked, they heard a click. The mum thought her hips were dislocated. We had the girl walk down the hall. Click, click, click. I checked her shoes. She had a piece of gravel stuck in the tread of her sneaker. The mum turned beet red. A patient came in, convinced he had rabies because he was foaming at the mouth when he brushed his teeth. He had switched to a new toothpaste that was extra foaming. He legitimately thought a raccoon had snuck into his room, bit him while he slept, and now he was symptomatic.